Welcome to adaptnclex, and thank you for clicking on this message. As you can see on the screen, can you pass without any SATA 75? And I've heard a couple of students say that. So I just want to address that information so that we can be on the same page. And so listen carefully and see how I can break it down. This is how I think. So you have to know what the SATA question is. The SATA question usually is content in disguise. And basically the whole nursing board plan is for you to get certain knowledge, entry-level knowledge as a nurse to be able to function appropriately, to be able to prioritize and be able to take care of patient as you advance through your learning process. And therefore, they came up with this information, select or that apply about a certain condition. And what it means is your content that you know, and then they distribute it in a different format. How can we present information in a different format so that you can think critically? So it's a critical thinking idea that if you know your content, I give you information in the content form, straightforward. Can you answer it? How about if the same content, I want you to think about it in a risk factor form? What is causing that problem? Can you answer them? But I'm not going to give you one answer choice. I want to choose two answer choice that is related to that disease process. And then when you know the risk factors, what do you think? They want you to know whether you'll be able to find the signs and symptoms of that patient. So they'll give you more symptoms that is related to that condition. So they want to see how you can weed throughout information and said, hey, this is not associated with that problem, even though they look similar. And then when you know those symptoms, you can educate the patient and then teach them. So they're trying to like play a game with your mind. And so they set all these questions in circle. And that's how they bring out, they cannot set this question just pure content. They won't be tested. They won't test what they plan to do. The testing plan is to make sure you critically can think and you are a safe nurse. A safe nurse should be able to recognize certain things that can cause morbidity and mortality to the patient. And that's your prioritization. And you can see that SATA is a form of prioritization. So I'll put prioritization here like that. And all is related to the signs and symptoms that you think is more dangerous. And the teaching that you got to do that is more dangerous. And which risk factors is more dangerous for that particular problem, and what content is play a role in your prioritization. And you put a select or apply on top of it. So they are all interconnected, facing each other. And that is what the nursing plan is all based on. So you want to know why and whether you can pass without a SATA question. You have to know how the test is graded, and that is the key. And so if there's the different kind of question in the test. Okay, you have a couple of questions. So you have a content level question. Okay, so you have just content, pure content. You just have to recall. Without, if you don't know it, you know. If you don't, then you can't recall it. It's just a pure memorization of recall. Like, what is the age to get colonoscopy? It's a pure memorization. Okay, those things are pure memorization. What age you're supposed to be able to walk with your 2 feet on? Yes. What age are you able to roll on your side? Pure memorization and content. It doesn't require any critical thinking. Then they have questions that require critical thinking. Okay, and basically application questions. Okay, those are the ones you need to worry about. So critical thinking and application questions. So those are the application questions. And guess what? What are the application questions? Teaching, education, looking for risk factors, and intervention and prioritization question. So what do you think? Which of this form bulk of your test is those things that are more important? The teaching you provided, the education you're going to provide to the patient, the risk factors you should look for to be able to prioritize the patient that, oh, this patient I need to see first. And intervention, the same thing that I need to see first. So this are what is going to give you passing. So that's why they have passing level question and non-passing level question. And therefore, when you start the test at 0, you'll be here. They will give you questions to go above. So this is the passing level right here. The questions are designed to be an adaptive in nature. So that is the right way, adaptive test. So they give you a question, easy question. They expect you to know it. As an entry-level nurse, this question, you have to know it. So you get it right, you move up. They will try to give you another question that the idea is to get you to the passing level. So most of the initial questions you get, the 5 questions you're going to get on your test is the most important, or 5 or 10. They're trying to get you to this level. So they keep on giving you the question that you'll be able to. Remember, as you answer the next question, if you answer one question right, the next one will be slightly, they're trying to test your knowledge. They start moving from content to teaching, education. Prioritization questions are more important. They move up in chain because that requires combination of all this information. So as soon as you get to the passing level, the questions start getting harder. They're going to give you things that you have to prioritize. You have to combine. You have to critically think. You have to analyzing the content and apply it and teach the patient. And so or you have to know certain things, 5 things about a condition. Let's say I can tell you appendicitis. Which of the following should the nurse do when the patient coming with appendicitis? Where the patient need to be NPO because they have infection in the abdomen, right? If the patient is NPO, I need to make sure I'm resuscitating the patient, have IV fluid, right? Patient has infection, we need to give the patient antibiotic, right? If patient have infection, they have pain, I need to give you pain medication, right? And then what is the main reason? We want to prevent sepsis, okay, mobility, and that's prioritization. And therefore, we get the patient ready for surgery. And guess what? They will give you a question that they'll put boxes here. Then you select, you say, oh, which one the nurse should do? You should do this, do this, do this, do this. Your critical thinking. And those are the harder questions. And so as you pass the passing level, now they want to keep you above it. They give you harder question. If you can, you'll go down to a question that is on your level, that is lower. If you can answer this question, they'll go a little bit lower. If you don't answer, they go a little bit lower. You don't expect to get a SATA question here when you are that low. Because then if I give you a harder question with the SATA, select all that apply, you dip all the way down here. You keep on going and sinking. And therefore, in order to come up, you should be able to answer those passing level questions, which is related to select or apply. It's an adaptive, but it can think and say, look, I want you to critical think. It can figure out who can critical think based on the questions they're giving them. That's why if they keep giving you the other questions and you are above it at 75, you say, no, I have confidence in that nurse that the nurse is safe. And so they will stop here. So you know my answer, right? That is the key. You know my answer that in order to pass this test, you should be able to see the SATA question. And this is why the next generation is so important. This is a typical next generation question. I have a video on this. You take this, for example, and then should expect which additional finding based on this case. They are not getting rid of the SATA. They are modifying it, they are changing it, but it's the same thing. You may get partial credit, but now almost all the tests, all the cases, you have to compare it with another diagnosis. You have to know 2 things. They can give you appendicitis and compare it with ectopic pregnancy. And you have to critically think and say, which one is associated with ectopic pregnancy, which one is associated with appendicitis. So now differential diagnosis. In doctor term, when we say differential diagnosis, they give you a bunch of information. And you said, oh, this diagnosis may be related to another disease process. But I know that appendicitis, you should not have there's certain things that you should not get. I mean, the pregnancy test should be negative. If the pregnancy test is negative, then it's ectopic pregnancy. But all of them can have right lower quadrant pain. They can have fever. They can have nausea. They can have hypotension. All of them may be related. But then you start to differentiate diagnosis and say, this is specific to that. So SATA is not going away. Select or apply is not going away. But it's going to be in the different favor and ability to get more score. So for this question, you can see I've given you expected, unexpected. This is a typical question for DKA and HHS. So it's a question that I did, HHS versus DKA. You're doing differential diagnosis, and you're trying to figure out which one is associated with DKA, which one is associated with that. So do you think this is DKA? Is it expected finding or unexpected finding? What do you think? This is a SATA question in a different form. In a DKA, so the question is for the diagnosis for DKA, but then they've given you to compare and think about it. Like patient with DKA, is their pH lower, 7.5, or this is unexpected? It's an expected finding. Do you see rapid deep breathing? Yeah, that cushion breathing, right? You see fruity scent? Yeah, do you see it? All these things is you have to start thinking. Do you see urine specific gravity greater than that? They dehydrated, okay? Diabetic patients are usually dehydrated. So what do you expect? I want you to choose the answer and let me know. Polydipsia, what do you think? Are they polydiptic or not? Is the PCO2 is 55? I left those answers for you to think about it. That require critical thinking and application level. And this is what select or that apply in the different flavor, in the differential diagnosis. And this is what you'll be seeing in the next generation cases. Therefore, can you pass 75 without SATA? Think about it. I don't think so. That is possible? No, I don't think so. So you're going to see a SATA question no matter what within 75, and you should be able to answer them. So just be comfortable with them, be able to handle them. And if you want more content related to this, check adaptnclex, and we'll make you comfortable with select or that apply. Take care of yourself. Bye-bye.